speaking about skin health and skin diseases, everyone wants to have a lovely, amazing, glowing skin. But there is definitely a lot of effort which goes behind it, and also a certain kind of maintenance routine which one needs to follow. So today with us, we have Dr. Sarisha Singh with an experience of 23 years in dermatology. So very welcome, Dr. Sarisha. How are you?
I'm great, thank you.
Great. So, we are having a conversation on, various kind of skin disease and then what are the most popular skin diseases in Indian skin. And also, since we got this question from our audience that what are the most popular skin diseases which one needs to be aware of during the summertime.
So in terms of the common skin diseases that we see in summers, the commonest problem we see in a dermatology outpatients department is skin infections. We see a lot of fungal infections. We're a tropical country, it's hot, it's humid, it's an ideal weather for fungi to grow and thrive. We see a lot of fungal infections in the elderly, people who have immunocompromised states like diabetes. But we see a lot of fungal infections in perfectly young, adult, healthy males and females, and even in children.
Yeah, because there's so many vast number of infections which one can catch during the summertime, and also a lot of teenager kids, whose acne are just spreading all over, and just because of dandruff, which also does dandruff also increases during this season, because a lot of kids and teenagers, they face dandruff issues and acne issues, and then they have acne on the back, all around the face. So what is the reason? Does it also related to the summer, or it can happen in any weather?
So there's scientifically speaking, there's no seasonal variation to acne. Coming to dandruff and acne, dandruff does not cause acne. The two tend to coexist, because it's the same internal problem which leads to both dandruff and acne. It's basically hits when they turn 13 to 14, 15 and they hit adolescence. Due to the hormonal changes, the hormones increase the size of their oil-producing glands, which cause both dandruff and acne. We do see a lot of acne during the summer months, but I think it's more because that's also the time when teenagers and young adults are off from school. Yeah. And they tend to focus a lot more on themselves, and it's a good time to start treating acne, and it's a good time to start getting into a healthy lifestyle and a healthy skin routine, because they have the time and the mental mind space to do it during the summer break.
Yeah, but how can one maintain? Let's say if young adult is having excessive acne, how can one take care of it so that it doesn't flare up a lot?
So the best thing one can do in the adolescent years is to have a regular skincare routine. If the acne is not too bad, they can get products over the counter and use it. But if the acne is troublesome, and if they find that over the counter products are not adequate to control their acne, or especially if they find that they start having scarring due to acne, the recommendation is to go on medical treatment. Ideally, they should see a dermatologist who would give some medicated creams and ointments to help reduce the burden of acne. If creams and ointments doesn't work, you can always scale up to tablets as well. But it can be easily controlled.
Creams and start with some topical cream and proceed
Start
from
with
there.
some topical creams and ointments and scale up to tablets if required. And we also generally advise an active lifestyle, because we do see that a lot of teenagers and young adults, they have this hormonal imbalance called polycystic ovaries. So the consultation will always also include a discussion on lifestyle factors, like the diet they eat, and including regular exercise in their lifestyle.